real honor to host the 21st International AIDS Conference in Durban in 2016.
We are going to shake the government, our government. We're going to shake the United Nations AIDS program. We're going to shake PEPFAR. We're going to make them all recognize that they must stop being complacent and just using clever words and clever terms and get this epidemic under control.
The reason science by itself can't end this epidemic is because this epidemic does hit at the people generally in society, no matter where they are, who are most vulnerable, who are most isolated, who are most criminalized, who are most out of the system.
I can recall when I was at that conference and I saw people living with HIV, activists who were so angry that they were threatening to, to cut themselves and splash the blood.
The World AIDS Conference is held every 2 years. This year, Durban plays host to the international AIDS community. Much has changed since the last time the conference was held in Durban in 2000.
In 2000, nobody was receiving treatment. We had a President Mbeki, who was involved in denying a link between HIV and AIDS. We were seeing an epidemic that was on the rise with very, very large numbers of people dying.
There was a decision by the International AIDS Society leadership to go to Durban precisely because the denialism that was underway was such a barrier to moving forward. And the then president of South Africa was a man of really global stature, who had a great deal of respect across the continent. And the fact that he had taken this position, this not evidence-based position, and denying that HIV was the cause of AIDS and therefore refusing to implement prevention and treatment program was an enormous problem. Yeah, I think in some ways it was a high water mark of activism and medicine coming together as one and saying, this is unacceptable, this must change.
I can recall when I was at that conference and I saw people living with HIV, activists who were so angry that they were threatening to, to cut themselves and splash the blood. And it was in the middle of a talk by the Director General of WHO at the time. She stood there, looked at them as if frozen, and all of us were frozen. We didn't know what to do. And the concern they had was, why is it that we're not able to get treatment? We're not able to get access to antiretroviral therapy. And they fought hard. The Treatment Action Campaign fought hard. The community fought hard. South Africans fought hard. And eventually, the world listened.
I can remember being there and marching in the streets of Durban about treatment access. And while people didn't get on treatment the day after the conference, the fact that we have 15 million people on antiretroviral treatment, including the largest treatment program in South Africa, that's not about science, and that's not about PEPFAR. That was about civil society standing up in Durban 2000 and saying, we demand access for all.
In 2002, the Treatment Action Campaign and the AIDS Law Project won a court case against the government, forcing it to provide antiretroviral therapy to pregnant women. A decade and a half of AIDS treatment has seen some major advances, the greatest being in the prevention of mother-to-child transmission.
When we first started using just single-dose nevirapine, we had transmission rates of 25%. Before that, it dropped down to around 8 to 10%. And with the current drugs that we're using in this country, we're seeing transmission rates of between 1 and 2%.
Around 2010, we had about 80,000 babies that were born with HIV. Now we've got about 5,100. So that's a huge success for the country. I mean, we should be excited about that this country has been able to deal effectively with the prevention of mother-to-child transmission.
Despite the successes, the battle against HIV has failed to make an impact on the high rate of new infections.
This year, several 100,000 people will still die of AIDS. Today, 300 people will die of HIV and TB, of AIDS today. And close to 1,000 people will be newly infected with HIV. In some ways, I feel that we are a country that has dropped its guard against HIV. We've kind of feel that because there's now treatment, because there's no longer a conflict between government and civil society on over-treatment, the issue seems to have gone away. But the epidemic has not gone away.
I think the first thing we need to do, which we are not doing, is educating the population about HIV. The population is becoming ignorant about how HIV is transmitted. We're becoming ignorant year after year, and that's not just in South Africa. As I look at the literature in other places like the UK, for example, the population is becoming ignorant. As we find treatment, people are no longer understanding or knowing how HIV is prevented. We need now to introduce new social and behavioral interventions that are going to help people to change their behavior.
Many people have come to view HIV as a treatable disease. Resultantly, they neglect to take adequate precautions against it.
Antiretroviral treatment has made it possible to live. But it's also made it possible to say, well, I can just take a pill every day. Well, taking a drug every day for the rest of your life, although it is important if you're infected, is not a great choice if you could be uninfected.
The international AIDS community is working together to end AIDS by 2030.
When you take antiretroviral therapy, you no longer develop AIDS. You still are HIV positive, but you no longer develop AIDS. And if you're taking antiretroviral therapy and you're taking it consistently as directed, the good thing is that you will not be able to transmit HIV to someone else. So that should reduce new infections. But to say that we will have ended the new infections, I think that would be wrong. The disease will still be there, but people will not be able to get AIDS, which is the devastating component of the epidemic.
Experts say the end of AIDS will only be attainable if HIV programming is designed around the needs of the groups amongst whom the rate of new infections is highest.
There are a number of groups that I think have been left behind along that way. I think that gay men and men who have sex with men are at higher risk for HIV. They're not really included in mainstream messaging. They're not included in services. So that's one of the parts of the response that we have worked on. I think sex workers, we've seen government come out with a very strong policy for sex workers, including pre-exposure prophylaxis. High-risk group, a group in which many of the new infections occur. And so clearly a place we have to focus efforts. And we've heard repeatedly and correctly about the need to focus on the risk for young women.
Pre-exposure prophylaxis involves the administering of antiretroviral medication to HIV-negative individuals who are at a high risk for contracting HIV.
In the research studies that were done, it's been shown to be very, very effective in reducing that risk by as much as 90% or more. And it's showing that if people take it, if they take this drug, they are protected against HIV.
The government notes that young women between the ages of 15 and 24, men who have sex with men, and sex workers are amongst the highest risk groups for contracting HIV.
The reason science by itself can't end this epidemic is because this epidemic does hit at the people generally in society, no matter where they are, who are most vulnerable, who are most isolated, who are most criminalized, who are most out of the system.
We should be focusing all our resources, our energy on what needs to be done to reach those people so that we can interrupt the rate of new infections. You know, to say there's 1,000 infections a day is is frightening. We ought to be able to cut it down to less than 100 a day or less than 200 a day, because we know where those infections are mostly.
Marginalised groups trying to access health services often face discrimination. A new concept in healthcare for men who have sex with men is changing this.
And so we're talking gay men, men who identify as gay, but also men who don't identify as gay, but have sex with other men sometimes on occasion. They may also have female partners. But when they go to health services, there's a lot of ignorance, there's a lot of stigma, they're treated badly, they're laughed at. And so our Health for Men program was set up to counter that.
Health for Men trains clinical staff in men who have sex with men's health needs, runs clinics that caters to men only, and coordinates educational campaigns to raise awareness.
The package that we provide for services, it's mainly focused on men who have sex with men. And it has been a wonderful opportunity for Nova Health and the Department of Health to work together to establish these services, because these services are basically within Department of Health clinics. So the public health clinics that you see on a normal setting. Services that are to do with STI screening, which is sexual transmitted infection, screening for HIV, so that when men test positive, they can be linked into care. We also provide some psychosocial support for men as well in terms of support groups.
Dr. Khadebe explains how these services have filled a gap for many men.
Especially for men who are also hidden, who don't come out as gay identified men, or men who are bisexual are also hidden and still live a life of heterosexual male. And we provide a non-stigmatized services. We don't discriminate. We make sure that we accommodate a lot of men who come in. They can come for various things, maybe for information, want to know whether they could be catered for in terms of their psychosocial needs, whether they can be asking about prevention. So we provide that.
Gordon Khoza works for Health for Men as an outreach team leader within communities across Gauteng.
We are the guys that go outside into the community. What is it that we do in the community? We provide HIV testing and counseling, because for some of the men who sleep with other men, due to stigma of the facilities, their local facilities, they don't access services like your HIV testing. So we bring the service to them.
We basically mobilize men who have sex with men to come test with us, and they get prevention from us. Prevention isn't like sexual talks and health talks, and we give out condoms and lubricants, and we always educate them every day about condom usage and how they should take care of themselves as far as STIs and TBs in and around the community.
Let's say, for example, we are in Orlando, and then when we identify one gay man who's coming to our tent, we'll approach that person and ask him to give us the contacts of his friends around Orlando, as I put Orlando as an example. And then after that, we will conduct a workshop with those men who are sleeping with other men in Orlando. And then in the workshop, what we do, we tell these people about the services that Health for Men provide as a program. We tell them about our clinics. We tell them about their local clinics that have been sensitized to cater for men who are sleeping with other men.
After a workshop, they map out an area to find out where men who have sex with men spend their time and whom they interact with. They then organize a social event and invite everyone.
What we've seen through experiences of having these events is communities listen to their leaders. For example, if we've got a station commander whom we've asked to come and tell these people in that location that any time when you are actually being a victim of hate crime, please, the police station open, doors are opened. So for them, it's a huge opportunity to actually see their local station commander telling them that. It's even a bigger one when the local pastor of a friendly church tells them that my kids were all born by God. We are all children of the same God. So don't be afraid to come to church. This church is welcoming of everyone.
Anthony explains why he feels compelled to educate other men who have sex with men.
I was just this different boy who played with girls all the time. So every time my mom, I would come to my mom and tell my mom that, okay, this is what happened. This guy said that I'm gay and whatnot. And then my mother said, okay, whatever it is, it's fine. Just take it as it is. And tell them it's not by choice that you are this person, but it's in you, you know. My mother, actually my parents to be exact, they were very, very supportive towards me being gay. And so that was just a pave way for me to at least educate other gay people in and around the community. For yourself, better yourself so that you can better somebody else for the future. Educate that person that be good in your own skin, feel comfortable in your own skin, and do whatever you want to do. This is your own life anyways.
What is the best way to combat the stigma and discrimination from people towards men who have sex with men?
If they can just reduce the ignorance and just accepting the fact that people are gay in the community would make a huge difference.
I think the most important thing when it comes to stigma and reducing stigma and discrimination among health professionals is to educate them. That starts with training.
If you give people facts, if you just have a short time with people, but give people facts and explain the reality and show them in their way of understanding, talk their language so that they can understand, then people will change.
This year's International AIDS Conference is being held in Durban, where experts are assessing the progress of the AIDS agenda to determine if they are on track. UNAIDS has set the 90 targets to be reached by 2030, that 90% of people will know their HIV status, 90% of HIV-positive people will be on ARVs, and 90% of those people will therefore be virally suppressed. Civil society plays a crucial role in ensuring that people have continued access to HIV medication.
3 years ago, the Treatment Action Campaign and Section 27 began to notice that there was a problem, that many clinics were running out of drugs. And so people with HIV would go to the clinic, they'd get there, the medicines wouldn't be there. And that is very bad for people with HIV because it may mean that they stop taking their medicines. We operate a hotline so that people can report stockouts in their clinic, and then we can try to make sure that the government acts quickly to get medicines there.
Stigma and health systems that are not as strong as they should be are some of the reasons why people are succumbing to AIDS.
Nobody really should die of AIDS today. But people are allowing themselves to get sick. They become fearful. They don't go to clinics. They don't go to hospitals. People die at home of AIDS because of fear. That's one of the problems. And the other problem is that our health system is weak. So there are still many people who live in rural areas or even who live in urban areas in informal settlements who find it difficult to access the public health system, or even if they access the public healthcare system, cannot get the quality of care that they are entitled to.
The government is working with the private sector and NGOs to strengthen our health systems so that we can better cope with providing ARVs to the millions more HIV-positive people who are becoming eligible for them.
For us, health system strengthening involves training people, bringing them up to speed with new clinical knowledge. It involves looking at workflow, making services as efficient as they can be. All of that is infrastructure strengthening. But beyond that, I think it's the capacity development of health workers to deal with HIV and with chronic diseases, which are becoming much, much more important.
At this year's conference, a lot of different HIV experts will report on interventions in their own fields.
I think we're going to hear a lot about treatment success. We're going to hear a lot about the challenges of maintaining people long-term on antiretrovirals, the need for adherence, the need for supply, all of the things that go with keeping a lot of people on drugs for a very long time.
We are going to shake the government, our government. We're going to shake the United Nations AIDS program. We're going to shake PEPFAR. We're going to make them all recognize that they must stop being complacent and just using clever words and clever terms and get this epidemic under control.
Stake at a critical juncture in the global epidemic. Yes,
With so much left to do, are we getting there? Are we making progress?
I have seen the worst and I'm beginning to see the best. It has taken that long for us to be able to begin to see the best. We're beginning to make progress. We're beginning to say, well, we're not going to go to funerals on weekends like we used to go. The science is giving us answers. The governments are beginning to use the evidence that they have. The funding agencies are coming to the table with money. The UNAIDS has become powerful in terms of bringing the stakeholders together. And the UN agency, as an agency itself, has also called the heads of state, brought them, to New York, and began talking to them about, let us work together.
Our history has told us that to make an impact on HIV, medical and behavioral science needs to walk alongside activism.
We have solutions. The question is, do we have the will as a country to prioritize our people? Because HIV means people. HIV means giving people power. Can we give people power through education, through access to healthcare systems? If we can, people will look after themselves.